Well, you think about nose surgery and what comes to mind, enhancement work to improve your look, but did you know that there's an entire category of nasal surgery in which the goal is to improve breathing through the nose?
It's called functional rhinoplasty, and Dr. Sang Kim from Syracuse Facial Plastic and Cosmetic Surgery is here to explain it. Good morning, Dr.
Good morning.
Kim.
Good morning.
Well, let's start with this. So what exactly is functional rhinoplasty?
Yes. So, traditionally, people, the rhinoplasty or nose surgery was thought of it as a, cosmetic elective plastic surgery to change the appearance of the nose. Within the field of facial plastic surgery, we've been learning more and more about this topic of functional rhinoplasty. Essentially, the goal is to fix the nose so that the patient can breathe better.
And what are some of the things that would obstruct the airway to begin with?
Sure. So, probably the most common cause for nasal obstruction is medical in origin, such as allergic rhinitis or environmental allergies. But there are a subset of patients whom, despite optimal medical management, they continue to have nasal airway obstruction. In these patients, typically the cause is anatomic or structural in nature. So, patients with a history of trauma to their nose, with crooked nose, or nose actually changes as one ages as well. It becomes more flaccid, the cartilages go through changes, and the valve starts to collapse. And then there are other individuals who are just born with nasal obstruction.
So this can affect anybody at any age, really, essentially, right?
That's right. Patients with who are naturally born with the nasal obstruction, typically they're on a younger side. And then I see a big, group of young men in their 20s with a history of, nasal obstruction, either from trauma or from, playing hockey.
Right.
And then there's the older demographics for patients with what we call aging nose, where the cartilage changes and weakness of the nasal valve that results in a collapsing and obstruction of the nasal airway.
Okay. And I think we have some before and after pictures, and maybe you could talk a little bit about each one. Now, this is a 13-year-old girl. Explain her situation.
Sure. So this is a patient that was referred to see me by an otolaryngologist out of town. And basically, her issue was not actually obstruction. She've never was able to breathe through the left side of her nose, ever.
At all? Wow.
So, since birth. But really, the problem for her was that her bone the septum was starting to grow into her cheekbone and was causing facial pain. Oh, so, in her case, it was a more, extensive repair where the septum was actually removed outside, completely reconstructed, and put back to reset the whole nasal airway. The goal again is to help her breathe better and fix the internal structure, but as you can see on the picture, oftentimes there is a external, appearance change too.
The byproduct of that.
That's right.
All right.
Wow.
So very helpful information. This was great. Who knew, right? You learn something new every day.
Yeah. Well, we want to let you know that the Syracuse Facial Plastic and Cosmetic Surgery is located at 4939 Brittenfield Parkway, Building B, Suite 210 in East Syracuse. They're now offering complimentary evening group seminars or consultation in a private setting at their newly renovated office. To learn more, just call 670-4468 or visit naturalfacecenters.com.
And we want to remind you that Dr. Kim and Syracuse Facial Plastic and Cosmetic Surgery are part of our Dr. Oz Wellness Network, and they've posted lots of great information at our website. Just click on the Sections tab at the top of localsyr.com, then click on Dr. Oz Wellness Network under the Marketplace section. Dr. Kim, thank you.